everybody, I am Dr. Sunanda Chava. Today I would like to talk about something called as Abscopal Effect. So what is Abscopal Effect? It's the effect seen in cancer treatment. So it was first coined by Mole in 1953, which means AB. Ab means away from, scopus means target. The abscopal effect is the regression of untreated tumors elsewhere in the body after a distant tumor within the same person has been treated with localized therapy. That means a tumor is here, another tumor is in the other side of the body. If you treat this tumor either by radiation therapy or other therapies like histotripsy, the effect is given even for the other tumor also. It happens, and along with this tumor also disappears. This effect is called as abscopal effect because it happens in targeted therapies. Targeted therapy means only tumor they are going to concentrate and they are going to treat it, but the other tumor gets treated. This phenomenon is thought to be triggered by the immune system, which is woken up by the local treatment to recognize and attack other tumor-like metastatic tumors. Some tumor cells after irradiation will release some substances like cytokines. These will go to the other tumor site and they produce immune response. So this distant tumor vanishes. This is called as abscopal effect. The combination of radiotherapy with modern immunotherapy has got good abscopic effect. The irradiated tumor can become a kind of vaccine with radiotherapy. It's important. The irradiated tumor can become a kind of vaccine with radiotherapy. It is called in situ vaccination. So there is another effect along with abscopal effect. It's not along with another effect. Similar to abscopal effect, that's called as bystander effect. So what is the difference between these two effects, bystander effect and abscopal effect? The bystander effect, the location of the bystander effect is nearby unirradiated cells are affected. Means if a tumor is here, nearby neighboring cells are affected to the neighboring to the irradiated cells. In the abscopal, this is bystander effect. In abscopal effect, distant unirradiated cells are exposed and they vanish. So, what is the mechanism in bystander effect? The localized intercellular communication where the signals are transmitted from irradiated to neighboring cells causes is the mechanism. Whereas in abscopal effect, systemic response often mediated by immune cells or factors released from irradiated tumor site. The mechanism is this. So it's a local intercellular communication. Here from the irradiated cells in bystander effect. In bystander effect, the irradiated cells will release some signals to the neighboring irradiated cells. So these will be vanishing. So this is called bystander effect. This is the mechanism. Whereas in abscopal effect, from the treated tumor, the immune response factors are released and immune response is woken up. They go to the irradiated tumor site, and then this will elicit, they go to the distant tumor site and cause the effect. This is the mechanism. It's a systemic response in case of abscopal effect. Distance is, in bystander effect, it is close to the irradiation site, neighboring cells. Whereas in abscopal effect, far from the irradiated site, tumor cells far from the irradiated sites are affected. This is an abscopal effect. Example of bystander effect. A neighboring cell experiences genomic instability after receiving signals from a nearby irradiated cells. Example. Whereas example for abscopal effect is a distant tumor lesion regressing after another tumor in the body was irradiated. So, on combining radiation with the drugs called immune checkpoint inhibitors, the immune response to the cancer can be enhanced. So, what are these checkpoint inhibitors? A type of drug that blocks the proteins called checkpoints made by immune system cells like T cells and some cancer cells. These are called cancer cells help keep immune response from being strong and sometimes can keep T cells from killing cancer cells. So a type of drug that blocks the proteins are called checkpoints. Checkpoints are made by the immune system cells like T cells, tumor cells, cancer cells. These checkpoints help keep immune responses from being strong and sometimes can keep T cells from killing cancer cells. Example, checkpoint proteins on T cells and cancer cells are PD1, PDL1, CTLA4 by B71, B72. Some checkpoint inhibitors are used to treat the cancer. And we have a abscopal effect which is seen in another mode of cancer treatment called histotripsy. Here, the ultrasound, we have heard about the ultrasonic scalar, which causes cavitation and causes the tartar or calculus to be removed from the tooth surface. This is a scalar, ultrasonic scalar. Here the mechanism is acoustic waves cause cavitation. If the same ultrasound energy is used to treat the cancer cells, that means the acoustic cells will cause cavitation and destroy locally the tumor cells. This is called as histotripsy. This also has abscopal effect. Thermal ablation also has abscopal effect. There's a lot of research happening in this topic, abscopal effect due to cancer treatment. This lot of research being studied. There's a lot of studies going on in this. And newly this histotripsy also has come in the field. So even that also has been used now to treat the cancer when other cancer treatments are not effective. So this will finish the abscopal effect. You can refer furtherly to know more points about abscopal effect and histotripsy. Thank you. Bye. Meet you in the next video.